Medical access system has grown over the years from a small private practice in Brazil to a medical specialist providing niche services to a number of large corporate clients. Here to discuss the services they offer is Dr Frits Sutmoller, a physician with MAS. Medical access system was set up in response to some quite specific demands. Tell us the background behind MAS.
I moved to Brazil in the early 80s and started work on research projects in both the respiratory infections in small children and AIDS vaccine trials. With that, I also started a private medical solo practice as a GP, which attended very much to the expatriates. These expatriates were very often the leaders of corporate clients, and they very soon came to me to request services for their businesses that they felt that they needed. It all started really with British Airways, which was starting to fly down to Rio, and needed support for their pilots and their flight attendants. And very soon, mining companies such as BHP came around, and we provided that service. That very soon expanded to the opening of the Brazilian market. Towards the outside world, and therefore the oil companies came in, and we went through all the having the operators and their supporting companies as our clients, and that was then we had got a whole series of requests of services that were needed.
So tell us more about the services and products you offer to your clients.
There's basically 7 major projects that we provide to our clients. One is the medical assistance. There really is a big demand and need for good quality care that people trust and feel comfortable with, especially as with our European and American background. They feel very comfortable with that, and that's important. The second one is that people need, and especially the corporate clients and the oil companies demand an alarm center, topside support for their operations, which is basically an alarm center 24/7. We have also medical emergency response teams that can respond to real emergencies, and that's both in the Macaé, which is like the Brazilian Aberdeen, and Rio de Janeiro itself. We also provide staffing to remote location. These are physicians. We've really stressed the element of physicians on these oil rigs because there is no such thing as a paramedic in Brazil, and so we are a strong believer that that is the service that is needed. We also provide occupational health services. And we do it within the international scope, as we do it along the oil and gas UK standards and FAA pilot physical standards. We also provide the training, so that's first aid training, and alcohol and drug policies, so that's with alcohol and drug testing.
And tell us about some of your corporate principles, in particular the Pearl values.
We strongly believe in them. They are very important, and the Pearl stands for the partnership, so that's really strong. MAS is a partnership of doctors, so we have a strong partnership internally. Our partnerships with the clients is that they really feel that they have somebody that they can rely on. We strongly believe in our medical expertise, that we have to be updated and be up to date with our expectations of what medicine provides. Available, and that's very much through the alarm center. That's the availability that people can always talk to us whenever they need us. We are reliable. They can, when they ask, it does get served, and we are proud of being leaders in making changes in the field.
Now, you were pioneers in offering doctors and medical assistants in remote locations in Brazil. What challenges have you faced in providing this service?
Well, the first challenge was that in Brazil we had the concept that nurse technicians were on board in remote site locations. That is, to us, a level of care that was not adequate to the expectations of our corporate clients. As there is no paramedic function in Brazil, professional group as such. We then upgraded it that it has to be physicians, and they have served us very well.
Finally, how do you see the needs and demands of your clients changing in the future, and how do you plan to address this?
Well, Brazil is going through a very challenging time, especially Rio de Janeiro, which will be providing the World Cup, Confederation Cup games now in these few days. Then there's the World Cup next year, and then the Olympics. So there will be a big demand for good healthcare provision and alarm center helplines in the near future. Brazil has also found a lot of oil offshore Rio de Janeiro, so therefore there's going to be a big new demand on the needs of oil rigs and installations. So there will be a big demand coming up to provide all the integrated services that we provide.
And you will be providing services to the World Cup?
Yes, we have already some clients that will have requested our services for the medical helpline, and we're proud to be there to do it.
Frits, thank you.
Thank you.